Hi, I'm Stephen Latham. I'm the director of the Yale University Interdisciplinary Center for Bioethics, and I'm here with Santiago Peregalli, and we're going to talk about Santiago and his own background and what he's been doing with the Summer Institute this summer. So start off, tell me where you were educated, what you studied.
Okay, thank you, Steven. So I started studying medicine in Montevideo in Uruguay. Then I continued my studies in Madrid, in Spain. And during my studies in Madrid, I came to the Bioethics Center for the summer program. And that's why, that was, let's say, my first contact with bioethics. Not my first, but the most important one. And I fell in love with bioethics at the moment. And then when I finished my medical studies, I moved to Switzerland, to Geneva, to do my residency in child and adolescent psychiatry and psychotherapy. What I'm doing right now, which I'm doing right now. And at the same time, I got a scholarship for a master's in bioethics and law at the University of Barcelona. And then, so I did my master's and I finished it. And now I'm continue my research in transgender rights, transgender adolescents' rights. So focusing in bioethics and also in the medical part, in medical issues of that.
So the summer program actually drew you into bioethics.
Yeah,
and
exactly.
that's the reason why you went to get the law masters at all.
Yeah.
So what kind of work are you doing in the transgender area?
So in the transgender area, what I'm doing is I'm asking if the transgender adolescent has the right to decide to get the treatment and to get into the transition to...
So things like hormonal therapy or surgery, you're thinking about at what age a child can make these choices and so on?
Yeah, it's exactly that. And so I'm analyzing the bioethical principles, and I'm really focusing on autonomy, justice, and so from that point to decide if they have the right to decide about their own body and their own decisions, desire as well.
And does it matter which thing they're deciding about? For example, do you think they could decide at a younger age to go for hormone therapy than they could decide to have transitional surgery, for example?
Mm-hmm. Well, I will say that they can decide to be happy, and they can decide about their feelings and who they are. I think it's more related to that.
Okay, great. So what are you teaching in the summer bioethics program?
So here I'm teaching medical humanities in Spanish.
In Spanish?
In Spanish, yeah.
Right, so this is the first year that we've actually had, you're also doing a discussion section in Spanish.
Yeah, exactly, yeah.
And that's because we have about, a dozen or so Spanish-speaking students in the program this summer.
Yeah, from different countries as well.
So how's that going?
And that's going great. It's a great moment also to explain your ideas. I mean, when talking about philosophy, bioethics, law, medicine, in a foreign language could be difficult sometimes. So it's great to have like a space to express your ideas in your mother tongue. And that's the idea of having a seminar in Spanish and discussion groups in Spanish as well.
And what are you talking about in the medical humanities seminar?
So in medical humanities seminars, we are focusing in the relationship about the patient and physician and how arts will help or not, that's the discussion, to become a better physician, a better patient, and how the interactions between patients and physicians will be shaped by arts. So we are like taking advantage of the Yale facilities, and we are visiting the Cashin Library Museum. We are also visiting the Yale Art Gallery, the British Yale Museum, and so on.
And are you reading any Spanish literature or poetry or anything about medicine? Yes?
Mm-hmm.
So Spanish readings?
Yes, all the readings are in Spanish. Yeah.
Excellent. So in addition to the medical humanities seminar and the discussion group, you're also teaching a psychiatry
psychiatry
seminar.
And bioethics. Yeah.
And what kind of material are you covering there?
So in this seminar we discuss about the relationship and the limits of the relationship between the psychiatry and the patients. We also discuss about suicide and transgender adolescents, so transgender rights, and bipolar disorders, bias, and stigma related to all the psychiatric disorders.
So, and the students commonly don't have much background in psychiatry or psychology at all, do they?
Yeah, that's an excellent question, because most of the students, they are like, oh, sure, I enrolled in this seminar because I have no background for this. But yes, you can, because we are having like a brief introduction to psychiatry in the seminar, and then from that point we discuss about all the ethical issues in psychiatry. And even if if you're not a psychiatrist, you can have an opinion about that. And that's the richness of the seminar, to share this different point of view about psychiatry and bioethics.
And do you have a sense of how many countries the students in that seminar come from?
I guess there are like more than 13 different countries in
Just
seminar.
in your seminar?
Yeah.
And do they approach psychiatry or psychology issues differently?
And that's super rich as well, because the approaches are completely different in every country. I mean, America has a way of working, Europe has a similar way of working than America, but then other countries are completely different because the resources are also different, and that's the rich part of the seminar, to share this different experience and how each country manage and plan things in different ways.
Wonderful. Sounds great. I wish I could take it, but I
You
wish
will
I could
soon.
take all the seminars. Yeah. All right. Thank you very much. It's been great catching up with you.
Thank you, Stephen.